Number two, on the Parkinson's plan's actions that you can take to lower your risk of Parkinson's is simply change your diet. Now, I say simply because everybody eats every day. And so every day you're actually giving yourself an opportunity to make changes that could potentially have a massive impact. And I know this sounds really generic. I just like to highlight that number two, they talk about diet right away. And of course, as a nutritionist, I could talk to you for hours about how to do this. But what I want to give you is the knowledge and the confidence that when you do start making good choices with your diet, it also can help lower your risk of Parkinson's. Now, I would say go beyond what he says in here. He says the Mediterranean diet is high in fruits and vegetables, and the individuals who do that have a lower risk for Parkinson's, and it can also be beneficial for those who already have the disease. And I love that. But let's go a step further and let's examine what people are eating in the blue zones, those areas around the world where people live the longest. They have the lowest rates of obesity, the lowest rates of heart disease, the lowest rates of cancer. So when you start to eat like that, you get all these other benefits. Now, do you have to entirely change your entire diet over to Mediterranean? Not realistic. But can you start to identify ways that you can add in something that is consistent with the blue zones and maybe remove something that is inconsistent with the blue zones? When people come into my clinic, I ask them about the things that they've eaten since I've seen them last. And one of the top things I ask them are going to be the foods that are going to be found most eaten in the blue zones. And I'm going to give you one right now that I want to share with you that is simple and easy and super affordable. And it is beans. Adding in beans. And I know anybody who's heard me talk before hears me talk ad nauseum about this, but I think it bears repeating. It's very important for people to know that this 5-country study financed by the World Health Organization found that eating 20 grams of beans daily, I would say average, reduced a person's risk of dying in any given year by about 8%. And is it any wonder? These black beans are full of all kinds of micronutrients that people are not getting in the standard American diet. So this is going to be something that I think is affordable for people to add in. In fact, I make a 3-bean salad at the beginning of the week, and it stores all week. It costs me less than $15, and that's lunch almost every day on the weeks that I make that. I think that's something that a lot of people would get a lot of benefit from, not just for their health, but even financially, to make that replacement for them. Just this morning, I had a doctor ask me about somebody who was having some heart concerns. And my question was to him, is he getting enough potassium? A lot of people aren't getting enough potassium, and that can create some symptoms that feel like something is not right in this world. And oftentimes, something as simple as adding in beans could be the difference in helping inform that person that it was something that they were missing in their diet that does that. Now, I don't want to go too deep into this because there's so much more I could say about this, but this Parkinson's Plan book is something I want people to know about because it is so encouraging. It is something that gives you so many things to do. You don't have to do all 25 or 26 as I'm going to do in this series, but if you could take something from each of those and start slowly layering them into your lives, becoming something that you can change, then of course, you're going to be putting yourself in a position of what you can do versus finding yourself in a position feeling there's nothing you can do. There is so much we can do always. And when it comes to diet, it goes infinitely beyond just adding beans in there. Another thing I would encourage people to eat a lot more of course, is fish. I love to use that acronym SMASH for the fish guidance, something like salmon, mackerel, anchovies, sardines, and herring. And of course, we want quality of those fish as well, wild caught. And this is where we're going to really start to learn that the quality of the food choices that we're making is going to greatly impact us over the long term. Another food that I would want to make sure that was on my dietary list if I was concerned about this would be eggs. So many people have avoided eggs, but there's something called choline that's found in the yolk of good, healthy, quality eggs that is very important for a neurotransmitter that helps us with memory called acetylcholine. We can't make it without it. So again, there's so much opportunity to improve upon in the diet. Anybody who has any questions about this more specifically, I can create a very specific diet about what I would want. But number one, there's an opportunity there, or number two, sorry, there's an opportunity there for you to change your diet and make a massive impact. And every day you have another opportunity to improve upon how you feel. Number three is coming soon. They're going to be a little more specific and more detailed as we go along, but the idea is to let you know that there are many things that you can do, and we're going to give them to you one at a time.